Thank you, Jelena, for your wonderful presentation. 4 H's here, absolutely humble and happy, healthy, and what was the fourth one again? So a good reason to attend the Bologna Congress. I would like to continue with the presentation of Louise. So at the end of the presentation of Louise, I do the interview with Anja and Rosa, and then we have the opportunity to also answer some questions out of the audience if they're there. Okay, Louise, there she is with a short glimpse into the future. AI in critical care. We can see.
It's a privilege to be with you today to present for this EfCCNa webinar, giving a short glimpse into the future of artificial intelligence in critical care. My name is Louise Rose and I'm a Professor and Research Division Head at King's College London here in the UK. So artificial intelligence and its use in critical care has the potential to revolutionise critical care in three important areas. Firstly, it has a role in predictive analytics. So artificial intelligence can analyse vast amounts of our routine collected data, enable us to predict patient outcomes. It has a role in diagnostics and decision support. So artificial intelligence driven decision support systems can assist us as clinicians to make more accurate, timely, and more personalised decisions for our patients. And it also has a role in automation of routine tasks. So it can automate routine tasks such as data entry and patient monitoring, the things that we do very often and continuously throughout a patient's ICU stay, which helps us as the clinical team to focus on more complex issues. So I'm going to show you a few studies that are out there in terms of these three elements. So what do we mean by predictive analytics? So AI can process vast data sets, and within intensive care we do collect a vast amount of data, not only that we document within the medical record, but also all of our technology is continuously collecting data that AI algorithms can then identify patterns within this data that may not be immediately recognizable to us as the clinical team. These techniques include machine learning. It's machine learning that focuses on numeric data or data that can be transformed into numeric data, such as X-rays and other imaging techniques. Or it can comprise natural language processing, such as what is used in ChatGPT, which helps us to analyze text within our medical record. And the largest volume of AI examples within critical care currently are in terms of prediction for a range of patient outcomes. So what papers do we have in terms of predictive analytics using machine learning relevant to critical care? So when you go into the evidence base, there are a huge number of papers focusing on a range of different outcomes and prediction of these outcomes. So we have AI for predicting hospital-acquired pressure injuries, both in and outside of the COVID patients. We have AI that's been used in terms of predicting illness severity in older adults with a large international study published there. We have use of AI to predict ventilator weaning success, and indeed there's been quite a number of studies that have looked at different ventilation outcomes with the use of AI. We've got prediction of ventilator-associated pneumonia. We've also got prediction in terms of looking at different staffing types and how these may have a relationship on patient outcomes. And also that imaging outcomes are looking at chest x-rays to be able to predict ventilation outcomes. And in this particular paper, again, it was looking at COVID patients. So what about use of predictive analytics using natural language processing in intensive care? So obviously, as nurses, we do a lot of nursing notes within the medical record. And here we have a study that's looked at interpreting nursing notes using natural language processing to identify clinical outcome prediction. Here we have another study looking at different behavioral disturbances. So we know we have our patients that can be agitated and delirium, and this has used natural language processing, looking at descriptors to be able to identify prevalence trajectory, treatment, and outcomes of these patients. Here's an NLP study looking at pressure injury surveillance. And here is a study again looking at nursing documentation and looking at sentiment within that nursing documentation as an indicator of predicting out of hospital mortality. So what about AI-driven support? So AI-driven decision support systems are obviously there to enhance the decision making that we do as clinicians. And they can be used to provide us with real time, which is obviously very important in intensive care, but also personalized to those patients, recommendations that can either be based on the latest research evidence, clinical guidelines, and incorporating that individual patient data. So these decision support systems may not only help us reduce errors, but they also help us standardize the care that we deliver within our own ICU and within different ICU settings, and indeed different countries and across the world. And as somebody who's conducted a number of practice surveys, every practice survey that we do identifies that we have variation in practice and potentially it is not adherent to our guidelines. So this is an important area that AI may be able to help us with. So again, what papers do we have? What is the evidence base that we have relating to critical care? So this is a study looking at how ChatGPT could help with alarm management in continuous renal replacement therapy, an interesting application. Here is an example of a paper looking at machine learning in terms of early warning scores for predicting hospital mortality, but this was not a predictive analysis. This was then incorporating this into real-time decision making in a clinical intervention trial. Here we have an example of using AI again for clinical support in monitoring our patients undergoing cardiovascular surgery. And this particular paper is a systematic review of work done in that field. What about AI-driven monitoring and diagnostics? So as I said, we collect a vast array of data within intensive care that we not only document, but within all of the monitoring and technology that we use in intensive care. So these deep learning algorithms that are AI driven can use the raw signals from our monitors, from our ventilators, and incorporating what is documented into the medical record to help us with diagnostics and monitoring of our patients. And again, what do we see in the evidence base in terms of what's out there in relation to critical care? So there's been several studies that have looked at tracking of level of consciousness and delirium, as obviously these are important elements of monitoring our patients that we focus time and energy on. But when we do assessment of delirium in particular, we generally only do this on a once or twice a day basis, and this can be missing the nuances of delirium that may be assisted by using AI-driven monitoring. Here is another example of a study that used a dual camera eye tracking platform, again to be able to give rapid and real-time diagnosis of acute delirium in the ICU. Here also is using a similar system looking at pain and being able to detect pain in an ICU patient population. And again, a second study looking at pain assessment and how this could be enhanced with artificial intelligence. So just to sort of elaborate on that a little bit more in terms of how we could adopt AI into our monitoring and diagnostics, with this paper really enhancing how we can use our current physiological monitoring, our electronic health record, and any questionnaires or patient reported outcomes we may be using with this additional sensing. So using cameras within the ICU, to cameras on the patient's face and body, able to detect eye tracking and facial actions, and be able to detect body movements. Using wearable sensors, again, to be able to detect body movements further, and using sensors within the room in terms of detecting light and noise that help give us a various range of other things that we can embed into our assessment in terms of patient's face, patient's facial action units and expressions, and all the data that can be collected and incorporated in our ability to better understand elements such as pain, delirium, movement, and integrate this into our assessment and monitoring priorities. Well, there's also a potential role of virtual healthcare agents. So we'll see here there is an upswing in the use of virtual healthcare agents in the use of chronic disease monitoring in the community. So potentially we have a role for these AI-enabled digital assistants with managing our ICU survivors post-hospital discharge, promoting their recovery. But there are, of course, challenges and concerns with AI. So there are technical barriers in terms of timely access to real-time data. There is lack of situational awareness. So I've shown cameras that may be able to recognize what's going in a room, but that won't tell AI in terms of everything that's going on and all that situational awareness that we use in our decision making. There may be fundamental bias in large data sets because of health disparities in terms of equity of access, and there are remaining legal and ethical issues in terms of data privacy. Also, there is a bit of a black box nature to many of our predictive algorithms and decision support systems, which may influence our trustworthiness of that and acceptance into our practice. So in conclusion, AI holds immense potential for us. It can transform the way we deliver critical care and nurse our critically ill patients by enhancing predictive capabilities, improving decision support and diagnostics, and increasing efficiency. So there is an imperative to address associated challenges to ensure that integration of AI into critical care is both ethical and effective. And with that, I will leave you. I'll be talking further on issues in terms of AI and expanding discussion on those studies that I showed you and maybe a few more. So see you there, and therefore thank you for your attention.